My name is Gretchen. I'm going to be doing an NG tube insertion for my checkoff today. Before I enter the patient's room, I would go ahead and check the patient record and check for any precautions I need to take before entering the patient's room, and then I was going to gather my equipment. So I'm going to walk in and perform AIDIT. So knock, knock, knock. Good morning, Miss NG. My name is Gretchen. I'm going to be your student nurse today. I'm going to be doing an NG tube insertion. It's going to take me about 15-20 minutes. Because of your appendectomy, it's going to relieve some of your nausea and vomiting. Can you go ahead and verify your name and date of birth for me, please? Thank you. I'm then going to go ahead and just lift you up, and I'm going to put you at a working height and at a 45-degree angle. And I would have gathered my equipment before I came into the room. Okay, very good. Are you comfortable?
It's such a mess, man.
I'm going to go ahead and put a towel over her chest. As well as a basin and a tissue in case her eyes tend to water throughout the process. So I'm going to go ahead and perform hand hygiene throughout, before and now, and then I'm going to put on gloves and ask the patient to blow their nose. And then I would assess for patency, so I would have her breathe in and breathe in again. So I would dispose of those in the proper receptacle. And then both of her nostrils were equally patent, so I'm going to go ahead and just do the one closest to me. I'm then going to go ahead and measure the tube for placement. I'm going to start at the tip of the nose to the earlobe, down to the xiphoid process, and then I'm going to measure and mark that with a piece of tape. Now that that's marked off, I'm going to go ahead and lubricate my tube. I'm going to lubricate about 2 to 4 inches, just swirling it around. And now I'm going to go ahead and insert the tube. When I insert the tube, if the patient has any persistent coughing, I'm going to go ahead and stop. So equal pressure, kind of down, and once it reaches the oropharynx, I'm going to go ahead and take a peek and look at the insertion, and I'm going to give my patient a cup of water. So I'm going to, when I place the tube into her nose, I would have her put her head back a little bit. Now that it's reached the oropharynx, I'm going to go ahead and have her put her chin to her chest like this. I'm going to have her sip water, and every single time she sips, I'm going to go ahead and advance the tube. So sip, advance. If I had any gagging or persistent coughing, I would stop. If I reached any resistance, I would go ahead and twist and try to keep going. Because this is a mannequin, it's probably not going to go all the way down to the xiphoid process, or the part that I had marked it to. If she was having problems breathing or speaking, I would go ahead and remove the tube. For right now, I've gone all the way to my mark, so I'm going to loosely secure it to the patient's nose. I'm going to remove And I'm going to check the insertion of the tube and make sure that it's all the way in her stomach and it didn't go into her lung. So to do that, I'm going to get an x-ray done, and I'm also going to aspirate some stomach contents. I would make sure to perform hand hygiene. And I'm going to take my syringe and take out a little bit of stomach content. And I'm going to go ahead and measure the pH of this using a pH strip, checking the consistency and color of the stomach contents. And when I measure the strip, I'm going to go by the manufacturer's colors and make sure that it's the correct pH for stomach contents. If I didn't get any stomach contents, I would take in 30 mLs of air and slowly insert it back into the tube, into the stomach, wait a second, and then try to aspirate again. I would dispose of those in the proper receptacles, making sure that when I took out the syringe, I was clamping. So once I've verified my tube placement, I'm going to go ahead and take this off, and I'm going to securely place it to the nose using the pants method. Before I do that, I'm going to go ahead and measure the residual tubing, making sure not to pull or cause too much tension on the tube. And I would have done that while the tube was secured. Go ahead and wrap this around the tube and properly secure it. When I raised up the patient's bed, I would have made sure to put down the side rail. So I'm going to go ahead and do that now. Make my job a little bit easier. Okay. So once that's secure, I'm going to go ahead and take a safety pin or rubber band and secure it to the gown, making sure that I keep it above the patient's stomach. So that's secure to the patient's face and the gown. I'm going to go ahead and have them turn, well, before I secured it to the gown, I'd have them turn their cheek just to make sure that they had enough leniency with the tubing. I'm then going to apply it to the proper section. And measure the residual tubing. So once that's all done, I will go ahead and clean her up. Thank you, Miss NG, for letting me do your nasogastric tube placement. I would make sure to perform oral hygiene every 2 to 4 hours, making sure that I keep the lips nice and lubricated. I am then going to make sure, I'm going to make sure the lips are nice and lubricated, and I'm also going to make sure that the nares and nostrils are as well. So thank you for letting me do the nasogastric tube placement on you. I'm going to position her into a safe and comfortable position for bedding, making sure that I keep her at least a 30-degree angle. I'm not going to lay her down all the way, but I'm going to make sure that the bed is in the lowest position. When I'm leaving the room, I'm going to do hand hygiene and do a visual safety check, asking if she would like me to keep the privacy, or she'd like to close the door. Make sure that her call light and her water is near, and then I would make sure to document all of my findings.